With the number of infections in the province rapidly rising, the health department is worried. 3 private hospitals in the Netcare group were forced to temporarily close their doors. Patients and healthcare workers tested positive. At St. Augustine's Hospital, at least 5 patients died from COVID-19 related complications, and 66 healthcare workers and patients tested positive. Experts have warned that people with underlying conditions including HIV and TB are more at risk. South Africa has the highest rate of HIV infections in the world. 7.7 million people are infected, with the highest prevalence in KwaZulu-Natal. This is a situation closely watched by the health authorities.
We need to go back and try to check what were the relations between these patients and COVID and these patients and their comorbidities. So the worry actually is that we're confused as to why all these numbers of deaths. We can't be contributing. Of the 54 deaths that have happened up to now, we have contributed 23. We've not been able to come with a scientific statement that says HIV and COVID are related.
The department says moonlighting by healthcare workers doubles their contact tracing work. At least 108 health workers are said to be infected.
But there is an aspect that says to us, some of our staff will work in the public sector, but also work in the private sector. You will remember that most of the deaths that have happened in the private sector. Most of the patients of the staff that we found turning positive were in the private sector. So are there relations between those? We think there are, but
the department is improving sanitizing methods at all medical facilities.
Our MEC said, I've seen this demonstration in one hospital, but it seems to be different from another hospital, such that standardization of the workshopping and standardization of the utilization of this PPE was again demonstrated.
Health practitioners are also appealing to people in densely populated areas to protect themselves.
Keep the virus within 1 centimeter of its origin, and that is your mouth. If you have a mask on, you keep the virus there. So if you're in a densely populated township, at least you will keep the virus away from your fellow human being, even your own family member.
Experts have repeatedly warned that South Africa's confirmed infections were not a true reflection of the spread of the virus in the country. A clearer picture is yet to emerge.
When you look at these outbreaks, each one of them is an education. They are guiding us as to how this virus is spreading and where we have weak links in our chain of protection against this virus.
A gender breakdown of infections in the province show that to date around 10% more women tested positive. The province has discharged 50 out of 133 hospitalized patients since the start of the pandemic. Jade Lee Paulser, SABC News, Durban.